everyone, and welcome to tonight's Building Better Business webinar hosted by FSOMA. My name is Natalia Morrison, and I am the Executive Assistant for FSOMA, and I'm so excited to have tonight. We are joined by Amy Sear. Many of you know her as a local teacher. She was one of my teachers. I'm just so excited to be able to have her on. She's an expert in Florida laws and rules and medical record keeping, and that is our topic for tonight, to create medical records and keep them simple and effective. So before I let Amy start her show, I want to let you know I'm going to be here with you all tonight. I'm going to be monitoring the chat box. So if you have any questions whatsoever, feel free to write them in the chat box. Amy and I are going to be monitoring it throughout the evening, and we'll try and address all your comments and questions as quickly as possible. Yvonne, hi, you said hello, and someone raised their hand. You can come onto the chat box and say hello through the chat box as well. All right, at the end of the webinar, there's gonna be a screen that pops up for a survey review of the webinar. Please take that minute to answer the survey. It's gonna help us be able to create these webinars that you all want to see. So without further ado, here is Amy Sear.
Thank you. Listen, hi everyone. Pardon my voice. I'm just getting over a kind of cold that left me with laryngitis, and I'm going to switch here to a different screen. So I think you're not going to see me. Whoops, let's do this. I got to do, what do I got to do? I got to do a little share the screen. Here we go. There we go. So listen, is it my slide that's showing?
Yes.
Okay, perfect. So if you don't mind letting me know if they've typed chat, because I lose the ability to see the chat box right now. Yeah, so anyway, what we're going to talk about tonight is some basics, all the building blocks for good medical records. Obviously, it's just an hour, so I can't cover every possible thing that must go into all medical records, but I'm going to give you folks a really, really good foundation, hopefully some new tips for each one of you. I'm hoping everybody walks away with something. And I want to say that the reason we're even doing this tonight, FSOMA and myself, is that recently Ellen Teeter, the executive director of FSOMA, and I was at a recent Board of Acupuncture meeting. It was December, just a little over a month ago, and there were 4 people up on disciplinary problems that all somehow or other had to do with medical records. So their actual discipline issue was that they either didn't keep medical records or they were poor quality. So at the very least, please make sure that you understand by tonight, which you will, what the state of Florida requires for our license. Because this is there's a couple headings, which we will cover tonight, of what content and rationale for what goes in your medical records, my medical records, whatever. There's a tremendous variety of how we can actually accomplish this, what they look like, handwritten, not handwritten, digital, dictated, you name it. So there's no one proper medical record for everyone, but there are absolutes, and way too many people in our industry, for any number of one or more reasons, really don't even know, quote unquote, a good basic underlying structure. And it's not out of them necessarily being bad. It's, for instance, like when I went to school, we weren't taught anything about medical records. Depending on when or where you went to school, especially how long ago, who you may have worked with over the years, on your own, with other people, people that had good medical records, people that didn't. And so I have already taught a, much more nuts and bolts, longer course than this. And I'm always offering to organizations to provide whatever I can. So anyway, this is me, my name and my contact information. So I do have a seminar business, a business that sells pre-recorded lectures that I've done. I certainly would love it if you'd consider any of those when you need courses. And then there at the bottom is an email address for me should you want or need that, okay? Feel free to send me emails with questions, okay? Now, let's go over basics here, okay? Number one, if you don't already know this, make sure you know we have to have medical records because of our license here in Florida, right? So there's laws and rules about the need and the content and the retention of medical records. And quite frankly, there's even a law and a rule that the records must be kept after we go out of business, after we move away, or after we die or get incapacitated or something like that, okay? So, and the way though that I explain that is that's what I call just bare minimum, meaning there's many, many other reasons that you have to have medical records and what has to go in them, like more than what our acupuncture license requires. But step number one, you have to have medical records. I mean, Ellen and I were pretty brokenhearted to see two people got in trouble. Both of them had records, but they were unbelievably without certain attributes that they needed. And two other cases, the medical records didn't match the insurance billing and vice versa. So there are two of the four had been reported to the state of Florida by some sort of healthcare insurance company because the practitioners had started with issues there. Okay, so the gist of quote unquote good medical records is not necessarily volume. It's not like 2 pages, 3 pages, 4 pages, and you get a better note by just writing a lot. So it might seem like a lot, what we talk about tonight or any other courses you might take from me or someone else, but it's not necessarily volume. It might be more volume than what you're doing now, but it's not necessarily about laborious volume. It's about the quality, the accuracy, the sentences better than bullets, things like this, right? So the actual content is what matters, all right? How it's written, what you leave out, what you include. And every single person's practice is going to have a different basic note structure. There's no one note that's perfect for all offices, all practices. For instance, if you never bill insurance, you don't need things in your medical records that the insurance world wants, needs, and requires. But if you ever bill insurance, your basic note structure should capture that information. And you don't want to have 2 different note systems like, oh, today it's Mary and Mary's insurance, so I'm going to do this. But you are going to make sure when you're treating a person that is going to be billed through insurance, you do make sure that certain information ends up in the note in a certain way that you may or may not if you're not billing insurance for that person. So the actual content is what matters. And people that do more manual therapies, things have to be in the notes around the doing of the manual therapy. If your whole practice, you don't do any techniques, you do quote unquote an intake, health history, diagnosis, herbs, diet, and lifestyle, there's a whole bunch of things you don't need in your notes because you're not doing a technique. But there are things that has to be in your notes when you're doing the diet, herbs, and lifestyle that you don't need if all you're doing is acupuncture or manual therapy, okay? So everything that happens, especially technique and patient instructions, things you tell the patient with emphasis or casually, so everything you say, see, or do has to be in the note, and you can't have things that did happen that aren't in the note, right? So what is in the note has to have happened, right? I'm telling you this is the trouble people have gotten into. Their notes said they did cupping, but they didn't do cupping. Now you might wonder, well, how would that happen? You know, they're just a ding-a-ling. Who would ever do that? How could you ever end up with a note that says there's cupping when you didn't do cupping? Well, the reason is too many people are doing what's called cut and paste. They're taking a past treatment, cutting and pasting the whole thing, transferring it over. You can't do, I mean, you can use cut and paste if you do it properly. It's not a good sign of a good note, but this is how things can end up in the note that didn't happen, and or vice versa, including just, let's say, sloppiness. And another way that I've heard through the grapevine that some people are doing that you cannot do at all is same as last visit. You know, today's visit just says same as last visit. You can't do that either. So anyway, okay. So in the state of Florida, and I would fathom this is true around the country, your notes have to be in English, okay? So just in case some other language is your native language, maybe even some of your patients' native language, nonetheless, medical records have to be in English, okay? Yes, you can use pinyin. We're not talking here about yin tang, tai yang, do 20, whatever. We're talking about everything else except the Chinese terminology. So it's better and best if notes are typed by hand, typed through dictation. It is possible you can have a perfectly good note by hand writing it. So legally, medical insurance, the state of Florida, they don't care if it's handwritten. But what I'm going to tell you is you're probably as a human being with only so much time and maybe stress, you're not going to get as good a note if you're still writing longhand. Okay, and what you're going to see in this next bullet point is bullets are not part of good notes, right? Now, an acupuncture point, bullet meaning short word, short word, short word versus sentences. Because sentences have context. Sentences are easy for someone else reading your note to understand what's going on. That's another thing. You'll see that with the stuff that I'm presenting tonight. A major purpose of these notes is for everyone else to read it. Some of it's for us, for me to know visit to visit, for me to look back 6 visits, 10 visits, 2 years, 5 years. But that's only one of the 6 reasons for medical records. The 5 others all have to do with somebody else reading, interpreting, understanding, taking action, validating, etc. So narrative is the best. It seems intimidating when you haven't done it before. Narrative means sentences. It doesn't matter if you longhand the sentence. It doesn't matter if you type it out in a Microsoft Word. It doesn't matter technically if you cut and paste. and it doesn't matter if you dictate. So dictating is talking, and software converts it into sentences, or typing narration is the sentences. So Mary returns to clinic after a 5-week absence. In the meantime, she reports that her left-sided low back pain is significantly better, specifically her ability to walk up the stairs at home. Her hot flashes has remained the same, but she recently was diagnosed with hypertension, right? So sentences rather than just low back pain, better, hot flashes, same, hypertension, something like that, right? You want sentences. Now, when you convert from just bullets, right, freestanding words or phrases, it seems, holy mackerel, how can I possibly get these sentences? I don't know how to write them, and it sounds time consuming. But there are methods, certainly classes, a longer class that I've done. Actually, I did it at FSOMA and I recorded it and I sell it on my website, gives examples of how to do these sentences. But also, these can be pre-written sentences that you use inexpensive computer software to populate, right? So if you have certain sentences that you use a lot, very inexpensive software that's available in the open market, it's not unique to medicine, and you can make these phrases in advance, and with just a few keystrokes of some odd jumbles of letters, the whole thing populates. Another way you can do sentences, if you don't even want to get into like software, is you would have a note, your paper, let's say, already filled out with gaps, right? Name, person's date, amount of time since last visit, there's a line, you fill it in. Mary comes into clinic complaining of, you fill it in. You can have a lot of these things and you put a 0 with a line through it if that didn't happen. There's a lot of ways to make this easier, not like virgin writing the entire full sentence, every patient, every visit, okay? But absolutely, positively, narrative, which is sentences. I told her that I highly recommended. The TDP lamp was placed above her bilateral knees at a height of 18 inches, monitored every 5 minutes and moved from right to left. Things like that. The idea of sentences. So anyone interpreting it, be it a jury, a judge, an insurance company, even another healthcare provider, it's very straightforward, very obvious what took place, okay? Can be understood by all parties that might read it. This is the reason we have medical records, right? Yes, medical records serve ourselves to help us keep track of what we've done in the past and who is this person and what are all the drugs she's on and everything. But there's a million other reasons and people that need to be able to interpret these, okay? And as I said before, your note for any particular visit cannot be same as last visit, okay? The treatment might be the same, but you can't write that. You have to replicate what you did, okay? Because if it's not there, it didn't happen. There's no proof it happened if it's not spelled out. And no way is any one visit exactly the same as the one before. The treatment might be, but other things that were said in either direction are never the same. Okay, so no one template exists that works for all offices. If that was the case, we just give you a template. Number one, there isn't a template, right? Meaning the underlying substrate that is the way you organize notes in your life and in your creation. Plus, even if there was, you still need to know what to do within that template, but there isn't. So I'm going to tell you tonight the 6 underlying reasons that I've come up with in teaching this material. And each one of those has attributes right? Attributes that drive content. It's going to cause something to be included or not, something to be included and worded a certain way, okay? We're going to go over those 6 tonight. So therefore, the best note or notes are a combination of all these reasons tailored to the specific situation, right? A community style situation where there's very little talking, very simple treatment, it's going to have a completely different note for that type of encounter versus an herbal or a first patient or something with a lot of exam or something where you're giving a lot of instructions, okay? So tailored to the specific situation, the specific patient, and what's going on, you know, with them, what you're doing to them, what you're telling them, what they're telling you, what modalities you do or don't do, right? The office, right? You know, a sports medicine office is going to have slight variations from an internal medicine or pediatric or fertility or whatever you want to call it, okay? And then a big clincher is whether insurance is getting billed or not, because remember, insurance, third-party reimbursement, is someone else's money's being spent. So that third party wants to make sure that this visit, treatment, and what gets billed is validated, okay? Some more basics. So you can do this without software. You can have good notes with paper, pens, hanging file folders, and there's no law that says you can't do paper anymore. There's just a lot of problems with it, and when you get going with some form, assistance of some form from some form of software, and it can be cheap, you can do this on the cheap, you get much better notes with a lot less brain getting fried up, very straightforward, and you can get into a real groove with stuff, okay? There's a lot of nice tools. Now, I do work at a hospital. The hospital has a 10, 20, 30, 50, I don't even know how many $1 million program called Epic that they've bought into, which, you know, was a little bit of a learning curve for me, would be a huge learning curve for some of our colleagues. But once you get in the flow, and it's called designing your template, there are some pretty powerful tools, of course. But again, it does not need, you do not need Epic level software. And remember, me and my acupuncture skills really only tap into a small attribute of the Epic system. But nonetheless, now I'm very enamored with utilizing software. But if I was in private practice tomorrow, I would do this using, I'm an Apple person, so I would use the program called Pages, which is like Microsoft Word, with a couple other software. So I'm telling you, you do not need designated or expensive medical records software. You can use that. And just because you have software doesn't mean your note's going to be great, but the software is tools, okay? So some kind of software does make it easier to create a better note with very little work, okay? A phenomenal looking note with much less work than you might imagine, especially when you decide on a structure that all your notes are going to follow for each visit, okay? And again, you can use designated, some medical practice management software has parts of it that do medical records. So whatever, dig in. If you're already using some practice management software, find out all the things that you can use it to do. Find out if some of the software that I'm going to tell you about will integrate in it, right? Number one, There's software called, I think it's called like Type Generator or something like that. I have to think of it. It's on one of the slides. Oh, Text Expander software. It's on the next slide. And of course, there's dictation software, right? Remember, dictation just means talking, and it creates the sentences, periods, new paragraphs, commas, quotation marks, question marks, whatever it is within the structure you've already set up. So some of the practice management software, these tools I'm telling you will work in it, right? Like the things I'm telling you about will work inside Microsoft Word, will work inside Pages, will work inside, I use it inside this Epic software. So, but keep in mind, if you don't want to spend a lot of money, you're working on your own, you don't already have practice management software that does your records, or it's not very robust, Microsoft Word or Pages, which is the Apple, it's like Microsoft Word. I find it a lot better, but it's essentially the same thing. These are good enough. And you can actually handwrite all this out if you want, or you could create, a pre-written thing that you fill in that has sentences, and then you fill in certain things. But I find the digital to be the best, okay? You can make a pre-created template. So let's say you're using Microsoft Word. You create a document that has everything where you want it, your sentences that you're going to check yes, you're going to write in no, you're going to fill in things, again, either by hand or typing. You create all that, and then you keep creating save as, right? You could have 4 or 5 of them. One of them could be for when you do actual treatment, acupuncture or a manual therapy or a TDP lamp or acupoint injection. And you can have a second one that you do when you do herbs, right? You can have 2 pages, 3 pages, whatever you want to do. The sky's the limit. And then there is pre-created phrases. Again, you could build in that template and utilize in different ways. In my opinion, the greatest software tool that is not that expensive, that once you get used to it, is you can't live without it, and that's dictation software. The number one, the next slide is some resources. So you'll see it in writing on the next slide. But Dragon Dictation is extremely well-known software that's out there for PC computers and Apple computers. You just get the right version. There's a chance there's a version for an iPad, but my fear is that it's not, quote unquote, robust enough, right? Because you want a good quality microphone. There's a couple attributes that make Dragon work better. But Dragon, that's just the name of the proprietary product, is fantastic dictation software. So you can say things and you can teach it our Chinese words, yin, yang, yin, tang, do 24, do 20, Ren meridian, Chong meridian. You can teach it that in a matter of minutes. So don't think that, well, it's not going to do, some of the Chinese words. And also keep in mind, most medical records have minimal Chinese terminology in them. Not necessarily 0, but it's not a high percentage. The high percentage is English with a little bit of medical terminology thrown in, okay? And something else you want to be careful of if you use software. Yes, it is possible to, highlight, cut, carry something over. Just be very careful, because this is when mistakes happen. You carry over something that you did on the last visit that you actually aren't going to do today, or vice versa, or you make an oversight. And yet then you're committed legally to what you pasted, okay? So there are pros and cons to cut and paste. So these are resources. Number one, recently, just last month, Douglas R. Briggs wrote an article on page 20 of the Acupuncture Today that I thought was really good and got to the heart of the matter on some attributes of medical records, okay? Improving medical records and some of the issues with the low quality of medical records that we acupuncturists tend to create. Certainly you could get actual medical record software out there if you want. There could be 40 different ones out there in the medical world by going to medical conferences or looking things up. You can use just good old-fashioned Microsoft Word or Pages by Apple. Dragon Dictation. Dragon is, it's not the name of the company. I forgot the name of the company, but it's the proprietary name of a very high-functioning dictation software. They do have a medical version that's $600, $700, or $800 that you do not need to get. It's nice. The hospital has the medical version. So if I say tamoxifen or Nexium, it knows how to spell those immediately, but you don't need that feature. Again, if I was doing this for myself, I would not buy the medical version. I would handle those parts manually, or if there's weird drug names on stuff, you can teach it. There's a method within Dragon where you click on it, there's a box, you type the word that you want to show up in your document, you click a button on your microphone, you say the word, right? Like yin tang, Y-I-N space T-A-N-G. And it looks like, hey, I'm popping up here with something in the chat box. And then, so I would type Y-I-N space T-A-N-G. I'd hit the button, yin tang, however I want to say it. And every time I say it that way, boom, Dragon knows what I'm doing. And then text expander software you can use. Type it for me with a 4 in it is an Apple. Again, I do everything in the Apple world. It's a extremely well-known, let's see here, we got 2 chats. Someone's asking if this presentation will be available. The answer is yes. You can check with Natalia, but she is apparently recording it. Oh, there, she already answered it. How wonderful. Yes, it'll be on the YouTube page. Cool. Okay. So anyway, text expander is the concept of the software. Type it for me as a brand. So you don't even have to get the brand. Just if you want, look up type it for me and you'll get the idea. So you can create a phrase, a sentence, a whole freaking paragraph if you want. I have maybe 25 of these that I use at the hospital constantly, right? Like instructions on how to take an herbal formula, where to go for more information about cranial sacral, a typed out description of the liniment. You know, if I apply a liniment on a patient during a visit, inside Epic is a box that I can type that are called patient instructions. This is another part of your medical records. And that part is printed for the patient when they walk out the door. So all these instructions. So I have one that says, the liniment that I applied today during your visit is called blank, blank, blank. I tell them all about it. I tell them where they can buy it. If they buy it, how to use it. And I click, wait a minute, period. I click 4 things on the screen and the whole paragraph populates right there in patient instructions because I created it in advance. Okay. There we go. Okay. So here are the 6 underlying reasons, the grand totality of what, why, how, and like what and how for all medical notes, including visit by visit by visit by visit, okay? So 1 is our scope of practice. I'm assuming you're all from Florida. I'm going to talk about Florida's requirements. For us, right, we take notes and we record notes. so we can remember from visit to visit, whatever we want, what we did. If somebody says, Amy, I love what you did last visit, hate what you did 2 visits ago, I can look it up. For whatever reason, for us, for the patient, for other healthcare providers, insurance reimbursement, and what we call risk management. And I'm going to tell you the 2 most important, because they require specific information to be said a specific way, is insurance and risk, all right? So number 1, in the state of Florida, we have FS 456, 457, 64B1, and there's 456 again. All of these are places within our laws and rules that identify medical records. So starting with chapter 456, which is this huge chapter that regulates about 20 different scopes of practice, us included, calls us a records owner, okay? And we have to create, store, and protect and maintain for a long period of time medical records. Number 2, our laws, chapter 457, 109, 1M, is the disciplinary section. So there's actually disciplinary consequences, right? Get in trouble with your license, with anything from fees, reprimands, go have to take more courses, suspensions, probations, any combination of the above. Failing to keep medical records justifying the course of treatment of the patient, okay? So 64B1, which is the rules of acupuncture, 10.001 is called content and retention of medical records. And I'm going to show you these on the next slide. You can get access to any of our laws and rules on the internet anytime you want. And you can go to 64B1, 10.001. But believe it or not, it does not mention that we need the patient's name, but I'm telling you, you better have the name. You've got to have the date of service. And it also doesn't even list even one complaint. And I can tell you, you can't have a medical record where there isn't some reason for why they're coming in for care. Now, it can be wellness, right? Theoretically, a person could come in without a complaint and they could be here for management. But most people are going to have some specific objective. So even though the state of Florida, 64B1, 10.01, does not mention name, date, or some form of a complaint, reasons, goals, etc., please make sure you do those. I call this bare minimum, right? So this is not enough. These things that we're going to see here in a second, A through G, is really not enough. And remember, we're only talking right now about one of the 6 reasons for medical records, right? We're talking about the state of Florida. So this is what they want, but I call it bare minimum. And we have to keep these records for 5 years after the last visit with the patient, okay? So this is A through G. We don't have time to go through 1A through G. If you're completely unaware of them, do a screenshot right now, come back and watch the video later, write them down, or you can easily find on the Florida government website or the Florida acupuncture site, or you could email me and I'll send you the entire rules document. You can read them one by one. But bare minimum, you've got to have a medical history, any kind of acupuncture diagnostic information in there, sophisticated or simple. They don't care if you're fancy schmancy or not, but any of your acupuncture impressions, any treatment or acupuncture that's done, any and all actual treatment modalities, right? Tui Na, cupping, gua sha, rubbing, acupressure, craniosacral massage, on and on and on and on, TDP, moxa, anything that's done must be done, okay? Any recommendations or referrals or instructions, the progress, right? So progress means on visit 2, how'd you do since visit 1? On visit 3, how'd you do since visit 2 and the beginning? Tracking progress, okay? That's actually very important for insurance. And then anything in the realm of imaging or testing that was utilized, okay? Just another thing to point it out and move on, you may or may not know, there's also a section in our rules where we have to, in advance, set up what's going to happen to medical records of our patients if we die, terminate practice, move, things like that. So if you're unfamiliar with that, please go there. Okay, so now what I want to do for the bulk of what time is left, let me see on the calendar. Okay, we got about 20 minutes. So what is important is also reason number 2, we write medical records for our own needs. I'm not going to cover anything about this one because 1, I assume you're doing that already, and 2, you can't get in trouble, right? We're here to make sure people don't get in trouble tonight. Tonight is to reach out and provide things a little bit more urgent or, I don't know, insurance and risk management. Plus, there's no real important format for us. I can write it any gobbledygook way I want, the part of my note that is for my edification. This is the least complex, the most intuitive, and the one most of us actually are probably doing. I'm hoping anyway, unless you're saying same as last visit. Now, third reason for notes, and it's not just the reason, it drives the content. What do I put in my note? How do I do it to satisfy all these 6 reasons, right? You need one note that satisfies all 6. So remember, the patient has a right at any time they want, and there's federal laws for this and there's state laws for this, right? You have no grounds to withhold giving a patient a copy. So if you know the patient can ask for it and can see it, you're going to not write certain things and you're going to write other things. You're not going to lie. I'm not saying you're putting things in there that aren't true, but you're going to write them in such a way. So remember, 1, they have a right, and 2, they might ask for a copy of their records, okay? This one isn't, there's not a lot that I can convey about this, except they might get a copy. This is why I caution people, be careful how you write up very personal information, right? There's plenty of professional ways to reference highly personal things a patient might have revealed to you, but to do it in a very professional, benign, factual, medical way, so that, if the patient sees the records, they're not upset about the way something was written, okay? It's also why you choose what to include in a medical record and what not to include in a medical record. But for us and for the patient are not the areas that we're either the most efficient in or that there's very many problems with, okay? Now, other healthcare providers. So this is a whole other reason for clean, clear sentences that make sense, look professional, right? And that certain information is included. Because if other healthcare providers, depending on who they are, see your notes, they make a judgment, to be honest with you, that, Amy's a ding-a-ling or Amy's a professional like me, right? So this is a big area why sentences and formatting and inclusion of certain things are important, okay? No. Don't seem to have a mouse here that I can open up. Something's in the chat, but my mouse isn't working. Okay, so now what we're gonna do is, so keep in mind, if you work by yourself, very infrequently is another medical person, right? I'm trying to find where the mouse is. Very few times is another healthcare provider going to see your notes, but it's not zero. In my world, I wouldn't doubt lots of medical people have read my notes because I can read their notes. And this is where certain types of sentences said a certain way come in. Oh, another thing about this, if you want to do better notes, read more notes of other people, right? So if you have the ability to read progress notes, visit notes, let's say of your patients that you have gotten or they've gotten from their other medical providers, this is where you can learn a lot about what's left out, what's included, tactful ways of saying things, professional way of saying things, right? I have accumulated all my information by being absorbed by other good notes. So the two most important areas that have often the most complexity to do them right, or seems impossible if you haven't been doing a good job of it. It seems like a big leap, but it doesn't have to be. But also the areas that can have the most money, hassle, or trouble associated with them is insurance reimbursement and risk. So Ellen at FSOMA, when we were talking about, you know, hey, let's do some little webinars or something on medical records, because gosh, there's an awful lot of people out there that really struggle or have questions about medical records. One of them was about insurance reimbursement. She apparently occasionally gets questions and things in the office where people have been denied payment because their notes weren't good enough. Now, notes for insurance is a whole other lecture, and I wouldn't even profess. I could teach a lot of it, but I couldn't teach all of it. There are certainly courses very, very specific to insurance that really dial in deep. But these 6 things you see here on the screen, medical necessity, right? This is a concept. Your notes are supposed to, within them, right? It's not a paragraph, it's a concept. It's an objective of the note. Is supposed to, when a third party reads the note, they're supposed to be able to understand, yes, this person, one, is a great candidate for this modality. It is functionally a candidate, and also it's worth the insurance spending the money for the care. Function and restoration of function is something you need to be capturing when you do an exam and an intake on your insurance patients, your patients you're going to bill insurance. You don't just say, okay, my pain, my right knee hurts. You get a pain scale if you want. There's different pain scales with pros and cons. But you also have to gather information on function, how they're functioning, areas they're not functioning, walking stairs, going to work, getting in and out of a car, ability to walk in a grocery store. Fairly basic function, and you've got to find out what's not functioning on the first visit and record it in a very functional way. And then as the future visits go, you need to be asking and then documenting if or not that function is getting restored. And if it is, you need to include it. A pain scale alone is not enough for insurance. I don't know if you know that, right? I know a ton of physical therapists, and a person can still be in pain and they have to graduate out of physical therapy through insurance because their function has been restored. So using sentences, adjectives, descriptors around function and any benefit or not benefit of that function is uniquely important in insurance that is not necessarily for the other reasons we've talked about, okay? Or risk management per se, right? So procedures, right? You have to understand CPT codes, which codes mean what, and your note has to match. You can't bill acupuncture if acupuncture is not in the note. You can't have acupuncture in the note and then call this cupping, or you can't call this 2 units of acupuncture if your notes only show 1 unit. So you have to understand what a unit is, but they have to match. And this is where lots of people are either getting denied payment or they're getting in trouble with insurance. They're not matching. The note doesn't justify the procedures, nor does it match medical necessity. And or a third party person reviewing it isn't able to connect the dots, right? There's discordance. Same thing with diagnosis, right? So the only diagnosis we can use is ICD-10, and we tend to use the functional or pain symptom type diagnosis, not disease diagnosis. But again, all these have to match, right? You can't say the problem is a headache, but you gave a treatment that has nothing to do with headache. And you can't have headache on the insurance form and not headache in your notes, or vice versa, okay? So a lot of it also is matching. And this is where another area people are getting into trouble. And time or units. With insurance, you have to understand procedure codes. Some of them are time-based, some of them are unit-based, right? Acupuncture is not time-based, it's unit-based, okay? Okie dokie. So again, these are the most important attributes about insurance reimbursement. So remember, insurance is all got their own way of doing things, and they care about function, medical necessity, and then properly understanding units, time, billing properly, and your notes have to show the problem, the function, restoration of function, and it has to match the procedures. Okay, and then this is another one that our industry has a lot of deficiencies in, right? Risk. Risk is essentially the word for protecting yourself so that medical harm or malpractice doesn't happen, and to have proper documentation. So if it happens, or if you're accused of it happening, your records is your only proof of what did or didn't happen, okay? And oftentimes it's 6, 9, 12 months later, and certainly not only do you not remember, judges and juries and things and plaintiffs go 100% by what's in our notes. So you can even have done things, but if they weren't in the note, it's seen as not happening. And if you didn't do things, if it's not in the note that you on purpose did not do them, there's no justification for that.
Amy,
Yeah, what's up in the chat box?
No one so far has had any questions besides, is this presentation going to be available?
Oh, okay.
And we will be sharing, I believe, tomorrow, if not in a couple of days, on our YouTube page. Carrie, I see you raise your hand. You can type your question in the chat box. If you have a question or a comment or a concern, anything like that.
Okay, because I just have this orange light that's flashing with chat, but I can't get my mouse to move over it because I'm in projection mode.
It's okay. I got it. I can see the chat box.
Okay. So I'll just keep going because I can tell we've only got a couple minutes. So
here we have a question.
Okay, go ahead.
We diagnose within terms. Qi, Shu. Do we want to include Western diagnosis?
Okay. I think I understand the question. So here's what I'm going to answer. You absolutely can use in your notes, because remember, we're not talking about giving good care. We're talking about what ends up in the note. You absolutely can use shu, any terms you want that are Chinese, qi, blood, shu, shui, whatever you want. Yes, 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 and yes, that can go in the note. And you use Western terminology, but there's no Western terminology that equals shu. But when you say Mary comes in complaining that she's gets exhausted by 9 o'clock every morning, or she feels nauseous after she eats ice cream, or she's had a frontal headache that occurs at 6 p.m. every night, all of that stuff is all English, medical or not medical. So don't use Western medical terminology you don't know, or that is wrong. Let's put it that way. You don't have to be just, throwing Western terms all over the place just to impress people. You use what's appropriate Western, you use what's appropriate Eastern. Both. Remember, because there's 6 objectives here. And other healthcare providers and us, we need the shu and the this and the that if you want, and you don't have to. So I hope that's the question you wanted to know. I get this a lot, can we say kidney yang deficiency? Of course. Can you say shu? Of course you can. But the rest of the note, because there's a lot more than Chinese going on in notes, especially this page here, right? Like, patient was treated today in the supine position, right? Position on the table. Your note should always indicate what position they were, for on the table or not on the table. Treated sitting upright in their wheelchair. Whatever the positioning is, that should be in a note for risk management. Exactly what you did. Now, obviously, acupuncture, colon, new line, ST36 bilateral, new line, GB34 left, spleen 6 right, anything like that, of course, is a little bit Chinese in there, but what you did, anything safety related, right? If you're going to do positions on the trunk, it's in my suggestion that you specifically mention what length needle you used, what angle you penetrated, what angle you inserted, and what depth you inserted. So, because what you want to prove is just as much what you didn't do or couldn't have done because of your technique. Another way to really learn about what I'm saying now is if you've ever read reports of surgical interventions, punch biopsies looking for skin cancer, a steroid injection. These, all of these attributes of exactly what you did is in there. Again, a lot of it is a template where things are filled out. So a lot of it is there in advance, and then you fill in the nitty gritty. But this is, quote, exactly what you did. Because one of the reasons our notes need to be a lot better is we're doing a medical intervention. We're doing a technique. And so what I do want to say before we close, the other real problem in our industry is that some various friends of mine in the industry are expert witnesses that are hired by attorneys. So they're either hired by an attorney that's defending an acupuncturist that's accused of something, or they're an expert opinion that's being hired by an attorney that's representing a plaintiff believing that somebody did something not right. And so these various colleagues of mine the only document that the acupuncturist can use to show what did or didn't happen to protect themselves or defend themselves is their notes. And way too many of my colleagues reading these notes say, Amy, we can't even help the practitioner because there's so much not in their notes. And, if you guys would be willing, if FSOMA's willing, if any of you can stand coming back, we could maybe do an hour just on this topic right here. Because if you don't know what can go wrong and what you can get accused of and how your notes can protect you, it's hard to kind of conjure up. Obviously, how can I do a better note? But certainly knowing the things going on out there. I'll give you an example. Somebody, there was a pneumothorax, right? So you look at the acupuncturist notes, and there's no information at all about needle depth, needle length, the actual length of the actual needle, the angle of insertion. So if it's not there, you have no way of proving that your needles couldn't have pierced their lung, is basically just because the information's not there.
Yeah, now, that's really good advice, Amy. Thank you so much.
Yeah.
Just wanted to, because it's already 8 o'clock.
Okay.
So to finish Carrie's question, she says, are there Western terms we can't diagnose? Doesn't that go outside of our scope of practice? For example, the diagnosis of neuropathy, if someone has numbness and tingling. She's concerned about saying Western things that we are not allowed to say.
Okay, so there's a lot there. One, we cannot diagnose a Western disease. I can't be the one that determines that someone has multiple sclerosis. But if a patient and their medical records that they bring in with them show that another doctor diagnosed, multiple sclerosis, I can put multiple sclerosis in the note, right? That's part of their health history, right? So that just differentiating. Number two, neuropathy is not really a diagnosis. Neuropathy is a descriptor, right? Like I feel nauseous, right? It's not like the root disease. Neuropathy is, if it's diagnosed by a neurologist with conduction studies, that's a form of diagnosing neuropathy that, no, you and I can't do that. I wouldn't even know how to. But when someone comes in with numbness in their toes or fingers, of course we use the word neuropathy. That's the descriptor of their complaint. If you don't want to use the word neuropathy, you could use the word paresthesia, right? Strange feelings. So yes, we don't diagnose them the first time with diseases, but we certainly can use all kinds of terminology that is what they tell us they've been diagnosed with, right? I don't diagnose hypertension, but all kinds of people tell me they have hypertension. And that goes in the part of my note, which is their medical history. Because I could argue if you don't put it in your note, it's as if you didn't know it, all that medical history. And then if something goes wrong and you've got a note with no medical history, it looks like you didn't know anything about the patient. If that makes any sense. So I'm, picking between the words of that question. Because parts of it are correct and parts aren't.
Thank you so much. Let's see. Pamela asked about how about a super bill? And then Yvonne.
So Pamela, I need you to do a different job. What do you mean? How about a super bill? Because a super bill is just an in-house piece of paper that the person, usually on paper, but it doesn't even have to be on paper, that the person doing the technique just circles what CPT code they did and what diagnosis code they use. And then that's used by whoever does billing to do the billing. So a super bill is not a medical record. I'm not sure what the question is. It just says, how about super bill? Does that make sense? So a super bill is just an in-house cheat sheet that we use from step A to step C to quickly record so that the person doing the billing uses the right code, the right codes. I think that makes sense.
Yeah. So my understanding is that, let's say with Carrie's question, patient came in, was diagnosed with neuropathy, has an ICD diagnosis by their just then the patient comes in and says, this is my report, this is what just diagnosed with me, I have neuropathy. You can then use that for your medical records because it's already, like you said, in the patient's
Yes.
medical
Yeah.
history. Now, would you use that ICD neuropathy code in your...
Yeah.
Okay, so, but if, like Yvonne has just asked, we can't give a Western diagnosis that they have not received by another MD, such as fibromyalgia, correct? So if your patient has not been diagnosed with fibromyalgia, you don't have an ICD code that was given by an MD or a DO or anyone else, then you can't really use...
Yeah, but we're getting into an area that, first of all, we're getting a little bit into, it depends, because it depends on whether you're billing insurance or not. But if you don't include their Western medical history, you're vulnerable. Because somebody's going to read your note and they're going to think, you know, Amy, you dingling, you never asked them about their drugs, right? I didn't even tell you guys today, a medical record, you better have every single drug that they're on and every diagnosis they've been given. Because if you don't know a diagnosis they've been given, you can be vulnerable. It's just,
Right.
Where do you put it? Like I have the way I set up my note. And it already says blank, so I'd fill in their name, comes in today for her first visit and evaluation, seeking the following goals. And then I type in the goals. Mary is a longstanding breast cancer patient who finished her treatment a year ago and is left with a number of remaining factors that she would like relief or reduction in. So there's her goals. The next section is her chief complaints. Chief complaint, hot flashes. Ever since she began tamoxifen, occurs at night with heavy sweating, whatever. Second chief complaint, you give all the descriptors, the whens, the wheres, the how longs, what makes it better, what makes it worse, where is it, all that. Third chief complaint. Then my next section says medical history. So this would say breast cancer diagnosed in 2015. She did not need surgery, but did do 5 years of tamoxifen, you know, blah, blah, whatever, right? So that's in the medical history. Hypertension, had a hysterectomy in 2011, was diagnosed with multiple sclerosis by her neurologist and is well monitored. Bing, 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 right? That's where you list all the drugs they're on. And any allergies.
So much information.
Yeah, so maybe we should do another one. I mean, I do have courses that go into this, like all of what we said today, plus more details. I've offered every single year to do this at FSOMA. It's just FSOMA gets so many lovely submissions every year. There just isn't time. But I'm happy to do a little more information if you want. Maybe we can do one where I show you the format that I fill out for my visits.
Yeah, I think that's perfect. I think all of you that are watching us tonight, remember, once we close up the webinar, there's going to be a survey that pops up. Try and fill that out for me. If you don't get the survey and you want to send me input and you want to say yes, thumbs up, let's do more of these webinars with Amy, send me an email. We are here to provide you guys with the best tools and resources. But we're gonna
before we go, I do want to fill in. So the same person that's been asking about Western typed in, this is important. Some patients say they have this and that without previous medical records. Yeah. So you write that. So first of all, if somebody says fibromyalgia to me, I say, okay, so who diagnosed you with fibromyalgia when? Oh, I don't really remember, or whatever. Then I would say, Patient self-reports diagnosis of fibromyalgia, but cannot remember who or when. That's exactly what I would write.
Yeah.
Or they'd say, my neurologist, diagnosed with fibromyalgia by a neurologist. If you don't trust the patient, you ask them to bring medical records to their next visit. The more medical records we get within reason, the more we're protected, because the less we know, like we can have vulnerabilities, right? So that's what I would do. Who diagnosed you when? Let's say they have back pain. The first thing I say is, have you ever had imaging? No imaging. I'm going to tell them at some point, you know what, you've been dealing with this for 3 years, you need to get imaging. Because if I don't tell them to get imaging, I'm liable. I don't know if that's a whole other thing on risk management. If we don't help them help themselves, we can be kind of stuck in the middle. So that's what I wanted to say. You're right, patients do say a whole bunch of stuff, but you ask for clarification. You know what I mean? Yeah. That's why the intake is so important. Anyway, listen, everybody, thank you. It was fun.
This was wonderful, Amy. Thank you so much for all your knowledge and your time. And thank you, all of you, for joining us. If you have any questions, comments, or concerns, definitely reach out to us. We're here to support you and help you all be successful acupuncturists. Thank you, everyone. Good night.
Bye, everybody. Come to the FSOMA conference.
Yes.
We'll all be there.
Yeah, it's going to be in Fort Lauderdale this year, so definitely you don't want to miss out. All right, good night.
Good night.